In this episode, I speak with Dr. Raquel Butler of Integrated Veterinary Therapeutics in Australia. We'll talk about listening to your horse when something doesn't feel right and the importance of a multifaceted approach to rehabilitation. So here we go, episode 169. Hi, I'm Karen Rolfe, and welcome to Horse Training in Harmony. This podcast is about you making progress with your horse in a way that you both can love. It's about learning how to move and be in harmony. Because yes, you really can develop a horse to be both athletic and happy. When we show up as our best selves for our horses will show up for us. So let's get started. Dr. Raquel Butler is a biomechanical medicine veterinarian from Integrated Veterinary Therapeutics in Australia. She's qualified in osteopathy, chiropractic, and rehabilitation for animals. She has a special interest in equine anatomy, biomechanics, and rehabilitation. So Raquel has been mentored by Sharon May Davis, has undertaken many dissections, studied a number of different bodywork therapies, taught clinics in anatomy, biomechanics, assessment, taping, and postural development, as well as in the Equine Science degree at Charles Sturt, Australia. She's a teacher for equinology and has recently launched her first online course, Equine Functional Posture, Stability to Strength. So I first met Dr. Raquel Butler when she took a clinic of mine when I was teaching recently in Australia. And it's just always so valuable when there's a veterinarian who also is a rider and who also is open to the kind of riding and teaching that I do, where we really listen to the horse. So it makes sense and it perfectly blends together, I think. So I think you're going to really enjoy this conversation. Raquel, so nice to have you on the pod.
Yeah, thanks, Karen. It's really great to be here.
Yeah, so you and I met recently when I was in Australia teaching a couple clinics, and so you were in the clinic there with your beautiful horse, and it was really fun to have someone with your knowledge and education there, and especially since the last session that we did together, Raquel just shows up bridleless and I just teach her. And I think halfway through, I was like, yeah, everybody, this is kind of unusual, but it was just so fun because yeah, you're bridleless. I'm like, yeah, sure. I'll just keep teaching without skipping a beat. And we just played to find the sweet spot of relaxation, energy, and balance with our horse. So I think before we get into kind of the veterinary and the rehabilitation and posture and movement sort of stuff, I'd love for if you could share a little bit of your story as a rider.
Yeah, as a rider. So I sat on my first horse when I was a year old, sat on my mum's mare that she had when she was younger. And I think that was the beginning of the end of me with horses. And kind of fell in love with them from that point. And then growing up, I didn't get my first horse until I was late primary school. And then I always had difficult horses. So I had, like a pony that would take off. I had a horse that would lay down when you did the girth up, one that would buck and rear and squeal if you didn't do the right thing. And then my last horse that I had became a head shaker, not my last horse, but like the horse, he was actually my first horse, but he was like my last horse before I had a break from horses. And he became a head shaker. So I had this number of difficult horses and I really didn't understand why, and I guess I thought that they were all behaving badly and I didn't know any better, and obviously look back now and realize we never looked at saddle fit, we never looked at why they might be doing those behaviors. We had massage therapists and things like that, but we often put them down to being naughty, And so I met a massage therapist, and I thought, oh, this is really interesting, and I really would love to know why my horses did all the things that they did. So I was really lucky to have this off the track thoroughbred who was very, very kind, and he kind of took me up the ropes of higher level dressage movements. Like, I didn't really compete that much on him because I only had him for a couple of years, and then I went overseas. But he kind of showed me what it was like to experience a bit of half pass, and started canter pirouettes and flying changes and things. And he was very, very, very kind-natured. I did a lot of eventing and kind of pony club and just low-level stuff as I was growing up. But now I'm really interested in like having those moments like I had at the clinic where, you're really kind of, I guess, in harmony with the horse. And I've lent more towards bridleless riding because I've had a pony before, Jelly, the horse I currently am riding, who, you'd put the bit in her mouth and she'd just go into brace and go into kind of mouthing the bit, and you didn't have anything there. So she kind of taught me a better way of listening, and she was my first horse that I went bridleless on, and I had a very, very special relationship with her, and we'd go out like trail riding bridleless, and we did our first working equitation bridleless. So we did that bitless because you're not allowed to do it bridleless over here. But yeah, I was kind of really interested in that. So that's kind of a very short version of how I've got to where I am. Riding.
That's cool. And I love what you said, when you went bridleless, it was a better way of listening.
Yeah.
And I think that's so important because, so much of normal riding, there's restricting things. There's martingales, there's nosebands, there's things that control so that the horse can't express the things that they want to express. So I really love how you said bridleless was a better way of listening, because you sure do find out.
Oh yeah, I found
information.
Yeah, a couple of times, because I kind of initially taught myself, and we had a few moments where we lost control. And one of them was at a clinic when I went bridleless the first time, and the instructor said to me, are you sure you want to hop on bridleless with no halter? And I was like, yeah, we'll be fine. And just as I got on, my pony got a fright. She took off towards the arena, like the side of the arena, and I thought, do I bail? And anyway, I was still on when I got around the corner, so I thought, okay, well, because I was bareback as well. So I thought, okay. And I got around the arena, and as she went past the spectators, she did a little pig root. And then I remembered, just flick up my neck, because I had a neck ring at that point. And I just thought, just flick that up. And then she just stopped. And it was like the second time we'd ever ridden bridleless. So I was like, okay, I think I need to work on a few more things.
Yeah. My general rule is, like, if you're not really experienced with bareback or bridleless, do one of those at a time. Like, if you're gonna try bridleless for the first time, have a saddle. Yeah. If you're gonna try bareback for the,
I was pretty good at the bareback stuff with her, because I didn't have a saddle fitted, so I was pretty okay with the bareback part of it. But yeah, the bridleless was a good first experience.
That's funny.
I love safer with Jelly as I've taught him how to do it.
Yeah. Well, he was lovely. I mean, if somebody wasn't really focusing, they wouldn't have even known. So that's pretty cool. All right. So maybe, I've shared in the introduction about what you do, but maybe in your own words, like, what do you do now?
Yeah, so now I have my own business, Integrated Vet Therapeutics. So I started that over 10 years ago, and went out of kind of being a traditional vet because a few reasons, but I was kind of a bit over treating symptoms, and I always knew that I wanted to go down the path of like chiropractic, and I was inspired by a vet called Dr. Ian Bidstrup to go down that path. And so I started my own business then, and then I was in that for about 7 years, treating horses and dogs full-time. And then I started teaching clinics with Sharon May Davis, and followed her overseas, and learned all this, like started to realize all the stuff I didn't know about anatomy and biomechanics, and did a lot of dissections with her. And then she handed me over her teaching of her clinics.
Wow.
And then I thought, oh, I really love teaching. And so then a job came up at a university teaching in equine science. So I thought, oh, I think I want to do a PhD. And so I started teaching equine science, which I really, really loved. But I did my honours, and I realised research is not for me. I'm a much more practical person. And so now I've gone back into my business, and I'm treating horses, running some clinics, and also just started my first online course. So yeah, that's all keeping me, and teaching for equinology as well, in their bodywork course. So I like doing lots of different things. I get, a bit stagnant if I'm just doing one thing.
I can relate a little bit to that. Yeah. So I think what's really interesting about you is not only your amazing, education as a veterinarian and all the different modalities, but also that you're a rider. And I personally love having vets or people that work on my horses and the body work that know what it's like to ride. And I know that the movement dynamic is such a big part of, and I think this is a really interesting thing to see, the movement dynamic and then the modalities that you apply. And for me with my horses, it's often a question mark of like, what needs to come first, or how do they work together? Because I've experienced sort of riding horses sound or using movement to create the soundness. But then there's also some times where you need something in order for the movement to improve. And so it's a very interesting, I was going to say confusing, I'll say interesting. It's an interesting thing. And I think I work with the movement a lot by feel and by building trust and communication and listening to the horse to get a result. And it can be really, really powerful. But with your experience also as a rider and the veterinary, like I'm wondering if you have insights into how do people, and I'm asking selfishly, like, how do you know when horses need these different modalities? I know that's a huge question, and probably you have some specific stories, but just in general, like, how do we approach it going, okay, I think I need to change the movement dynamic, and then they need a little chiropractic, and then after that, this other thing,
Yeah.
You get the idea, so go.
Yeah. That's a really it's a really complicated question, because
sorry.
put me on the spot. No, I think that it really depends a lot on your experience with horses, because I know myself, I'm kind of still learning that every single day, with clients' horses and my own horses, and at what point do I need to treat them, and yeah, what can I sort out with movement? And I think what I find really interesting, and this is just from my, like, I'll talk a bit about it from my personal perspective and then from a client perspective, because what I've been surprised at from a personal perspective is how much I can influence a problem with movement when I understand what the problem is, So if I'm like, okay, I know that Jelly's got a stiff, we'll just say he's got a stiff neck, and so then I'm like, okay, well, I can play with these different movements to help him find a better mobility of his neck. But if A, I didn't know that he had a sore neck, and B, I didn't know how to move it in a way that helped him, then I'm going to be limited, So at that point, I guess, so I've seen big changes using movement. And the more I'm becoming aware of that, the more I see that change. But then with my clients, sometimes they can't recognize that it's the stiff neck, and they just know that maybe the horse is having trouble bending to the right, but they don't know that that's because of, A, B, and C. So therefore they don't know how to change the movement to help him. So at that point, I'd say, well, if you can recognize there's a problem, but you don't know A, where it is, or B, the movement to utilize to unlock that place, then you probably need to get help. And I think that a lot of people put things down to behavior. And, I saw a little pony yesterday, and they said to me, this horse is lame, so the first horse I looked at, this horse is lame. So they knew they needed me because the horse was lame. And then they said, the pony, I think the pony's okay, but, I'm just not sure if he's being a pony, because he just started bucking a little bit going from trot to canter. And I think ponies especially get a bit of a raw deal because they're often like being a pony. And when I looked at the pony, I was like, wow, this pony's dealing with a lot. And it's amazing that it's only bucking from trot to canter, his whole body was jammed. And, because he was being pretty well behaved in every other facet, they hadn't been able to discern that. And I think because he was so jammed up, he wasn't able to communicate that. Mm-hmm. And so he was way sorer. So I think, and then that's where I'm really passionate, is about educating people to recognize physically, because behaviorally people get confused and they think that they're being naughty. And I still say 9 times out of 10, they're just trying to communicate. And there's always a reason. It's just whether we have enough knowledge or experience to be able to kind of figure that out. So yeah, I guess at the end of the day, it kind of comes down to your awareness. And I notice with my clients who know in-hand stuff and they're trying to ride in self-balance, they'll pick up things way, way quicker. And they'll also have tried things to alleviate it. But if you don't have that knowledge, then you're trying to push the horse through, and that's where it can come unstuck, or the horse just starts to kind of shut down and figure out a way to deal with it.
Yeah. I think it's interesting, to be able to step back every now and then. Trainers will often see things as behavior problems. Surgeons will say they need surgery, So I think that's interesting that you've noticed a difference with people who do more groundwork, because that alone is just a change of perspective. Mm-hmm. You're riding the horse, but then you see the horse, and then be able to step back again and maybe, have a way of looking at your horse when they're on the ground, or having some little test that you put them through, or bringing somebody in who can take that fresh perspective. I have different sort of bodywork people that come, and when I start having some sort of challenge with my horse, I love having someone come in exactly for that purpose of, maybe it's not okay, fix my horse, but it's more what do you see? What's a dynamic that this person can see that I'm not seeing? And then if it starts connecting with things that I'm experiencing training, and then so there's one is sort of noticing that there's something ain't right. Yeah. and saying, and then, I wonder what it is, getting some insight into what it is. And then, then there's the plan, and that's sort of down the line. But yeah, I find that really fascinating to okay, here's something, And then every story feels very different with every horse. So,
Yeah.
sometimes it's like, oh, they just need a chiropractor.
Yeah.
Oh, they just need a this. That I think in reality, and we hear a lot of those stories. Oh my God, this person came in and now my horse is fine. Those are often the social media posts we hear, but I think it's so complex and layered. So yeah, I love the specific stories. Do you have any other stories of real life, challenges, and then the layers of what was involved in turning it
Yeah,
around?
I think like you just said, sometimes you'll have the amazing ones where you come in and it's a one treatment, it's a one treatment like trick, you'll treat it once and they have this amazing transformation and like, you kind of unlock the body and then from then they just move forward. But I guess the stories that aren't always shared as frequently is the ones that you mentioned at the end there, like where it's quite a journey, and it takes a lot of commitment from the owner's perspective and the horse's perspective, and it's hard work. And I have a few of those where I'm pretty lucky. I have amazing clients, and I generally set them up at the start and say, like, you're in for the long haul here. If you want a quick fix, you're probably with the wrong person. And usually they've exhausted a lot of other options. But my aim is that at the end of the day, we have a whole horse that is better than the horse has ever been before, not just that the lameness has got better.
Mm-hmm.
And so, I have one at the moment who, off the track thoroughbred, so client's horse off the track thoroughbred, come to me with a chronic lameness. He's got some weird injuries, some weird kind of muscle tears, and as well as chronic stuff from racing. And so, when we're looking at his rehab, we're not just looking at rehabbing his lameness, we're looking at like rehabbing his whole body so that he's able to be more functional and he doesn't break down again in that same place. So like his journey's been quite challenging because I asked her not to ride him and until he's sound. And she's done lunging, but asking her to like use one pole and do really simple specific exercises. And his whole demeanor has changed. Like he is a completely different, behaviorally different horse. He's so much more present. He's more interactive. His whole body shape has changed. She's only hopped on him once or twice yet because we're still getting his feet sorted out. So hopefully that just happened on the weekend. And it's a process of like, and then she has to get a new saddle because now the saddle doesn't fit. So it's this whole rehab process where at the end of the day, it's massive for the owner, and they need a lot of support. But if they can sit through that, then at the end of, I think he's been well over 6 months, they have a completely different horse to what they started with. And I guess people might see the end product and be like, oh, you're so lucky, your horse is like looking amazing. And what they don't see is like the process that it was for that owner to get there. They've invested a lot of money, a lot of time, and they felt like at times that they were getting nowhere. And they have to have a lot of trust in me when I'm like, you will get there. You've just got to, we've got to unravel everything first and then basically put it back together to help him reprogram his whole system. And for some horses, that can be a longer journey than others. And some of them we're dealing with things that are going to be lifelong management. So yeah, it can be a very challenging journey for people.
Yes. Yeah. And, but I think, ultimately that's going to be closer to the answer that's going to give the long-term results. In so many vets that I've talked to, something that they're seeing that they're frustrated about at their clinics is the same horses keep coming in, re-injuring the same part.
Yeah.
It's like, oh, that's suspensory again. That's suspensory again. That's suspensory again. They keep healing it. And then they go back. And many vets kind of know what you're saying, but maybe they're not trained in all those modalities, so they don't feel like they can, or they'll just say, oh, my clients won't do that. It's a they won't do it. I'm like, well, not if you don't tell them, especially if you don't tell them. So I think what you're saying is so important, because it's rarely, I would say, just one thing. And it's so cool to have one person that has all those eyes, because around here often I have to piecemeal. I'm like, okay, for this horse, I'm going to bring this professional and that professional in, and they might not even like each other, but I'm going to, I have to kind of curate this team for the horse. So I think it's so, so cool to have veterinarians who are so educated in these different modalities, and riders, so the process of that aspect and how it can help. And I've even asked vets, I'm like, how many horses do you know that it's just the way they're ridden that's causing the injuries? And they go, oh yeah, a lot of them. I'm like, do you ever mention that? They're like, no way. So I mean, it's not about criticizing, it's just about, hey, here's something you could do differently in the warm-up, or here, something. So
and I've seen like really amazing transformations in owners where they were quite fixed in the way they were riding, or certain aspects of it. And I don't generally tell people, you have to do this, unless I feel like they're really really kind of open to that. Usually I just make suggestions and try to explain to them how those things might be having an influence, or how I might be still finding the same things. And often eventually the owners figure it out for themselves. And when they do kind of figure it out, and I'll show them exercises on the ground, I'll say, like you just said, can you incorporate this in your warm-up? And some of these owners have never done any exercises on the ground before. And I can tell when they've been doing it, because the next time I come, their horse just does this beautiful circle. And I'm like, you've been practicing. But yeah, like they start, like their level of awareness starts to change. And I think sometimes, they're limited by their own awareness, but sometimes they're limited by the trainer that they have, and that they don't have another option in that. And I'm not a trainer. Like I can see a lot of stuff, and I can help on the ground, but I don't like to interfere in, if they've got their trainer and they've got their hoof person, all I can do is kind of point out how I think it's influencing the horse. But yeah, I've had quite a few owners where they've come to their own realizations, or I've given them a DVD or pointed them in a direction, and then some come back and they're like, oh, I figured this out. And I'm like, oh, that's good. I've been saying it for a few years, but I'm glad you figured that out now, because your horse will thank you for that. Yeah. So yeah, sometimes it's just planting a seed. But I think if you don't try, which I've done as well, then you don't know. Because sometimes I had a student recently, and I just asked her the question, like, why are you, I noticed that you're using side reins, and obviously that's a bit of a contentious issue. And she said to me, I don't know any other way. Like, I don't know how to lunge him any other way. If I do, he's in the air and he's all over the place. And I thought, okay, like, yeah, like I said, well, there is another way. Like I can't show you, because that would take me a few months to kind of show you and your horse. But at least she, realized there is other ways. And so she will probably go and find them now, because ultimately she cares about her horse. But it's really easy to kind of judge and go and think, oh, like they're using side reins, why are they doing that? But or as a vet say, it's not, I'm not going to say anything. But at the end of the day, sometimes people literally, they just think that's their only option. So they've never seen any other way. And I think we forget that sometimes.
Yeah, yeah. And I think just the power of opening that possibility of like, I was teaching someone the other day myself, and it was the first time, and she had her horse in side reins. And I just sort of mentioned at one point, oh, I wouldn't have these. And she said, oh, you mean looser? And I said,
Yeah.
no, I don't even own any. And she was like, what? I was like, we'll talk about that next. But just that little like, wow, really? Is sometimes just a little idea. And, a lot of times trainers, this is not to criticize trainers, but trainers are often very specialized, and they're trying to train the thing that they're expert in training. And then when issues come up with the horse, like the pony, oh, it just bucks in that transition, then trainers end up having to try to solve this training problem. But I think a lot of trainers, like for dressage, it's like they want to teach dressage. They don't want to handle behavior problems. And if owners can sort of do their homework and go, I wonder why, and maybe we can make the horse comfortable, and then the horse shows up to the lessons not bucking, trainer's happy.
Yeah.
So sometimes it's just that little bit of self-advocating of going, let me investigate this, and not expecting the trainer to be an expert on this. They're just trying to get the stuff done that they want to train. And sometimes just that confident, the owner's waiting for the trainer to tell them what to do. Oh, go find this, go find Raquel Butler. They might not say that, but they do wish the horse was showing up not feeling like bucking.
Yeah.
So, I mean, I think we're already talking about this, but I read somewhere when I was Googling you on the internet, it said that you really do it. And it seems this way. You enjoy bridging the gap between equine therapists and trainers and veterinarians. So maybe you can talk, I think we've already been talking about this, but like, what is the gap? And what's the most common disconnects, and like, what do you want people, what's your message? What do you want people to know if you're standing in this beautiful place that can really connect the dots?
Yeah, I think that's another great question. I guess, what is the gap? And I think in some aspects of that, we don't always know what the gap is. And so that's probably the most challenging aspect of it in a way, is like, is it's not always clear what the gap is between a vet, a trainer, a hoof care professional, a body worker, a owner, a horse. Like, it's not always clear what those gaps are, because everyone comes from a different perspective of knowledge and experience. And what I see is sometimes we think that we have kind of filled in we can fill in the gaps. Like, I think as vets, we think we need to be everything, and that's a bit of how we're trained. And because we're kind of in that professional position, we feel the pressure of being everything for the owner. And I think there's a shift happening, but it's probably happening a bit more in small animals in terms of the gap starting to bridge in rehabilitation, and say surgeons starting to recognize where a rehabilitation practitioner can help them with that dog. And in horses, it's in Australia anyway, it's a little bit slower. But, I'm getting pretty lucky around here because I have a new grad vet who has interest in feet, and she's very well qualified in feet. And I have another really good trimmer. I know the local saddle fitter, and so I can chat to her, and I can refer for veterinary stuff. Like, I don't do x-rays and things like that. So they're starting to develop a bit of a team, but I would say vets are probably behind in that. And I think in bridging the gap, what I say the most is that the owner has to be the advocate for the horse. And I guess I see my job, because I have an understanding from all perspectives. kind of know about saddle fit. I know about hoof balance. I know about, rehabbing, because I've been through it myself with my own horses. So I can kind of come in and help them find the right person, but I can also come in and say, this is how you advocate for your horse. Like, these are the things that you need to look for in your horse to know when you need to do something. So, I might say, well, your horse shows when he starts biting, and he's not happy, and so we need to get to the bottom of it. Or some horses will just bite for different reasons. So that might not be, it might be different for two horses, but it's making people aware that they can open themselves to their horse's communication, and then they can use that to help them advocate for the horse and link the other professionals. And I had a friend who, her horse was very well trained, and he knew all the things, like he was like, yep, what do you want me to do? And he was ready to do everything perfectly, quickly, all the stuff. And then I come along and I said, okay, that's great, but physically he actually can't do the stuff, even though he's giving you the stuff. Like, he actually is struggling with it physically. And I said, see how his legs do this and his legs do that and his head does this, and see his facial expressions, and slow it down. And then all of a sudden he couldn't even barely do one step of the stuff. And she was just like, oh my gosh, I always just thought of it from a safety perspective, and like he had to be kind of submissive and do all the things. And when we slowed it down, he started communicating with her really quickly. So within a couple of weeks, like, she tried a new saddle, and I think I can't remember exactly what he did, like whether he stopped or whether he just threw his head a certain way, but she got off. And I think it was like the first time that she'd actually allowed like a two-way conversation to happen, where she recognized that, like, she'd open the door for him to communicate and say, that saddle is not comfortable, whereas before he would have just done the things. And so it's changed her whole way of being with horses, and she's an older lady. She's very, very knowledgeable. She's very, very well educated. But she just never looked at it from that way. And now she will always advocate for her horse. Like, she's, very much trying to listen to them now. So that's probably the best way to bridge the gap, is learn how to listen to your horse, and then learn how to have a two-way conversation, and then be their advocate when it comes to other professionals. And if you feel like that doesn't sound right, or they tell you, no, he's fine, you're fine, just keep riding or keep pushing, don't do it. Trust your gut and trust your relationship with your horse, because you're never wrong.
That's so powerful, that everything you just said there. I mean, there's so much to it, because it really gets to the core goal. Like, what are we trying to do with horses? And so much training is sort of the art of getting horses to do things they don't want to do.
Yeah.
If we really are honest with ourselves, like, that's at the core. It's like that the horse needs to learn to deal with it, tolerate it, do it anyway. And, sure, if he's limping, maybe it's stopped, but there's, And so this is more like, we want our horses to express, don't tell me. I want to know if that's not comfortable. And it can be a much more confusing place to be, because some horses are just expressive, and then you're like, no, but would you? And they're like, yeah, okay, I would. And so there's not every head toss is, oh my God, my horse is in pain, right? So it's easy to go down that road, and it can be I find very, very confusing decisions every day with my horse, of like, Are they telling me something? Does it mean something, or is it just a thing? Or, but I think ultimately this is a harder place to live. It's much easier to just go, shut up and do it.
Yeah.
That's easier in a way.
Yeah.
But it doesn't feel as good. And I think ultimately a lot of suffering happens. But yeah, I think this is the sort of messy middle that is tricky, because we want to listen, but we don't want to be so scared that we never do anything with our horses.
Yeah.
And there's just like with bridling, like, we listen to our horses when I'm tacking up or grooming, like, what are they saying today? Where are they reacting? But one of my horses, she can come out and I touch her somewhere and she's like, and I'm like, oh my God, and then if I just sort of sit there for a second and change my little brain and drop into the space and touch her again, telling her how beautiful she is, she's like, okay. So I mean, it's, you could say, oh my God, she's sore. Like, no, she just was making me be present and think good thoughts about it. Change completely. I mean, nothing like a mirror, right? But other horses, it is really meaningful. It's like, whoa, I got it. So I just want to kind of shout out to everybody out here trying to live in this space of listening to our horses. And, with bridling, I do teach my horses self-bridling, right? So they understand. And there's some days I'll hold up the bridle and my horse will turn their head. So it's like, oh my gosh, okay, that's meaningful. But then sometimes I just wait and they turn their head. Natia will do this. She turns her head and then she yawns, and then she'll like do a little something else and scratch herself in a couple places, and then she goes and sticks her head in the bridle. So there's this middle ground of like, do you need a second? Like sometimes she just needs a second and then she puts her head in. And so again, I'm noticing, and some days she just shoves her head in, and some days she looks away too many times and I go, I'm not riding you today. Right. So it's a feel thing. But I think for me, it's listening to all those little nuances day to day to day, because then I can start really noticing, oh, wait a minute, that was like 3 days in a row she turned her head away. And so let's look deeper. But it's tricky. I'm so grateful for people like you who can approach it, who can see it from so many different angles.
Yeah, and like for me, it's been a lot of trial and error. And I think if like having my own horses, they've been my biggest teachers, and I don't think that I ever would have truly understood that without having gone through that. And especially having horses that have kind of been there and done it the conventional way, and so they know their job, and then they come, so I've had a few now come to me, and then I'm like, okay, let's find a new way. And at the start they're like, what do you mean? Like they have no, they don't trust. And so the pony that I had, like as soon as I'd pick up the reins, so I had her in a bitless bridle because I'd recognized the bit was a problem for her, but I'd pick up the reins and she was like, okay, I'm ready. And she just like go into brace. And I sat there one day and I thought, oh, this is ridiculous. But I sat there for 40 minutes because Terza Hendricks had said you need to, wait until they move themselves or they stop bracing. And I would pick up the reins and she'd brace, and I'd drop the reins again and pick up the reins and she'd brace and drop the reins again. And I sat there, it was getting dark, and I thought, oh my gosh, like, I don't even know what to do now. Like, do I stay here or... Anyway, after whatever time it was, I picked up the reins and she didn't brace. And I was like, yay, and I got off. And then the next session, like, it was just completely different. Like she learned in that moment that like I'd given her a different option and I was going to listen. And we had a few sessions like that where she'd get stuck and I'd just have to sit and wait. And it was long, long periods of time. But every time we had one of those sessions, like it was a huge leap forward in our communication, in her trust. And, she got to the point where she'd tell me, I'm happy for you to ride me today. And she'd line up to the mounting block. And if she wasn't, she'd put her head on my shoulder and she'd push down.
Oh.
And that was like, no. And I trialed and errored because I was like, but I want to ride today.
Mm-hmm.
So, you know, a few times I would go, oh, come on. And I'd have like the shittest ride. Like she'd never do anything wrong, but her body would feel bad or like there'd, you know, be brace. And I was like, well, that wasn't worth it, was it? So like she being a mare, as you said, like, you know, she was really clear in teaching me, you know, and obviously I tried really hard to figure out how to listen, but she learned that she was teaching me as much as I was trying to teach her how to have balance in her body. She was teaching me how to like listen. And whereas when you get a gelding who's been through stuff, they don't make you listen. So Jelly's like super polite and he's like, oh, what do you want me to do? Oh, sorry. Like, and he's like, oh, I'm scared now. Like, I'll just run. You know, so like he was the complete opposite, being a gelding, and trying to please me. And I had to approach that very differently because I had to reassure him a lot, slow down a lot, take it back in a different way to, you know, be able to give him confidence. And Patch thankfully taught me how to listen because otherwise I'd take advantage of Jelly very easily. So yeah, it's an interesting place to be. And we had this conversation in my group last night and people saying, I don't know, like, yeah, I don't know how to progress. Like, I don't know what to do because I'm in that middle place where you said before, and I don't want to do the wrong thing by my horse, but I'm not really sure, you know, if I should.
Mm-hmm.
And it's like, you kind of have to trial and error and make the mistakes and learn what your horse, like, just try to learn your horse's level of communication and what's a hard no and what's a like, I just need a bit of time. And I think the only way you can learn that with the individual horse is a bit of trial and error, and you're going to make mistakes and you just have to be okay with that. And they will help you, like they really do help you along the way.
Absolutely. And I think this is why I want to, you know, call out this messy bit, because it's easy, especially as a professional, to go, I know the way. Here's this 5-step process. It's a miracle. And that's not reality. And I was reading a definition of mindfulness is when you begin to know that you don't know. Because when you know that you don't know, then you have to be here in this space, being open to the signs. And so I think that bit of confusion, as long as you don't get into the frustration, you know, part of it is just going, you know, what's happening here? What are they telling me? And that's what I try to do, you know, every time my horse, if they're eager, like you said, if they line up with the mounting block, or if they don't, and that we don't jump to a conclusion, oh, he's not lining up the mounting block, therefore he's in dire pain and he hates me. No, maybe he just got distracted over there and he forgot what he was doing for a second, right? So I think it's that, just for me, trying to be in the moment, going, look at that. And then I can make a conscious decision. It's like, okay, he was a little hesitant coming to the mounting block. I'm going to choose to ride, but maybe I'll be a little bit more mindful while I'm riding, or maybe I'll just go on a trail ride today. Like I'll err on the side of whatever. Or I might go, no, I think we're going to do this, but I'm going to do that consciously. I am making a decision to do this. So, and so I think what you said is perfect. Like you're going to have to trial and error it. You're going to have to listen. You're going to make some decisions that weren't the best, but if you're conscious, then you're going to learn from it. You know, when he did this, I chose to do that, and boy, that didn't work. You know, but then you're going to probably not repeat that pattern 20 million times obliviously. You're going to go, oh yeah, I did that last time and that didn't work. Next time I'll try something else. So
Yeah,
I
and
love
you
that.
start to recognize like the little signs that maybe you didn't recognize the first time. And then, but you start to go, oh, actually, like they did do this, 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 and this. I just thought that that was something else. And then, like, you start to kind of know little patterns that start to emerge, like when Jelly gets anxious about something, and it's not always, like you said, for him, it's not always pain related, it can be just anxiety related. Like he will start to mouth me. And then if he gets really anxious, he doesn't do it very often now, but if I'm videoing him, so obviously when I'm doing videos, I would get more anxious and he'd feel the pressure and he's like, what's wrong? And he'd start to bite me. And so he's had to learn how to like realize that just because my attention is not on him, and I've had to like really regulate myself, like what you said with your mare, like I've had to go, okay, he's just feeling my anxiety because I want to do a video right now. And so I have to really regulate myself, and I had to just do it with no one around for a while so that he could build the confidence in the process. And now he's like, okay, video time. The other day I had to tell him we were finished and he was still standing there like, no, I'd taken his halter off and everything. And he's still standing there like, okay, I'm ready. And I said, Tilly, we're finished. And he was like, oh, okay. And he just walked off. All right, I think he's okay now with the video. So
it's amazing how much they know what's going on.
yeah,
It's
and like
incredible.
I had another girl there helping me, and we just cracked up laughing because we were like, he's getting this now.
Yeah.
Yeah, really funny.
Yeah. No, they're reading everything, I think, just laughing at us most of the time. Because there's
Yeah.
just so many times we're in our barn with me and my assistant, and we'll start thinking of like, okay, in a little bit, I think we're gonna put these over here, and then I'll want to ride this other one, and we just wait, and so many times it's like, look, they're already walking over there, and look, this one's already coming over here. How did they know? Oh my goodness. Back to some more practical. So for people who maybe don't have someone like you who has all the different perspectives, do you have any insights you can give people of like, if they sense there's something not quite right with their horse, and it might depend on what the not quite right thing is, like what are some guidelines as far as, hey, you should bring a standard vet and get an x-ray, or you should maybe try a fascia person, or I think that's like, can you give somebody any guidelines as far as who to call first, or where to start?
I think if you've got an obvious lameness, so your horse is head bobbing and there's an obvious lameness, then definitely go to the vet first. So that's going to be your best port of call. If you've got a horse that's head shaking, then I'd recommend that you find a craniosacral therapist. If you've got a horse that is having problems, say, with the girth area, then you might start with a body worker, but you may need a chiropractor if there's a wither issue. And then you might need a saddle fitter to also check the girth and the saddle fit. What's another one? Like if, I think it often depends on who you have available to you. And sometimes, like I'll have horses where, say, myself and other body workers are treating them because we treat differently. And, I can come in with the chiropractic or the osteopathy, and they've had kind of their other body work. I think if it's a bit of a niggling issue and you're not quite sure, then you just need to find the highest qualified person, like in terms of probably body work, because from a veterinary perspective, if it's just a niggle, they're probably not going to be able to find it. Like, they're not going to be able to block it. So then you just need to keep searching for the person, and don't listen to, don't listen when someone tells you necessarily there's nothing wrong. Like, I think that's the most important thing. Like, even if you've had 5 body workers, or 5 vets, or 5 hoof care professionals, or 5 trainers, if you still feel like there is something wrong with your horse, don't give up. Like, I've had a lot of people come to me and they're like, oh, that makes so much sense. And I've been searching for years, and I, wish I knew this sort of modality or person existed. And so we're not all of the same mold. We don't all have the same knowledge and experience. And so you've just got to find that person who is able to figure it out for you. And so I would say in those situations, just don't give up. And sometimes it's the owner who figures it out for themselves. Like, they go and study or something. So I don't really have like a definite, like, this person for this and this person for that, except, obviously for lameness, definitely go to the vet. And for non-specific things, start with the body worker and your saddle fit.
No, that's super helpful.
Teeth checked, feet checked, saddle fit, and then kind of progress from there, because lots of things stem from those things as well. And your own body.
Yes.
Get your own body checked as well.
So say that again, because I think I interrupted a little bit. So teeth, feet.
So get the teeth ruled out, the hoof balance ruled out, the saddle fit, and your own body. And then look at training and, their ability to balance and move themselves. And then you kind of go to body work. Like, even as a body worker, I will often say, when did your feet last get done? When did your teeth last get done? What saddle do you ride in? Has it been fitted? And I might ask any other gear that you use and try to rule those things out.
No, that's super, super helpful. Those are some good guidelines. And I think it's helpful just to hear that it is complex. I always feel like, oh, there's something missing and why can't I find it? It's, and sometimes it's just complex. And yeah, I love the advocacy for the horse. So maybe tell everyone where we can find more about you or learn from you. And
so my Facebook page is Integrated Veterinary Therapeutics. That's probably the best place. I have recently got a website kind of sorted again because I let it lapse while I was at the uni, and so that'll be connected. And I've started the online courses, so the posture strength. Stability to strength. I'll have another one of those running in February. Like within that, we look at posture and we kind of empower horse owners. In the current one, we have lots of body workers, saddle fitters, hoof care professionals, and other kind of equine professionals, but we have a lot of horse owners too, who are just empowering themselves with awareness of posture and influencing factors, and then some exercises that can help, very simple stuff to kind of help them with that. So nice. Which is exciting.
Nice. All right. Yeah. So, and I'll put the link. It sounds like the Facebook page is the place to be for sure. And I'll put the links to your course and stuff in the show notes so everybody can find them there. Cool. Thank you, Raquel, for taking this time. This was awesome.
Yeah, thanks, Karen. It's been really good to chat to you.